How to give a back massage for back pain at home, step by step. While performing an advanced, therapeutic back massage requires plenty of professional training, you can still give someone a relaxing, tissue-stimulating massage even without training. By learning some of the basic massage techniques and how to apply them, you can begin giving quality massages at home. One of the most important parts to note is that without professional training, you should apply only light pressure with all of your techniques. Step number 1. Have the person lie face down. If you have a proper massage table, this means the person's face will rest in the face cradle. If it's comfortable for the person, you can also use a pillow or a folded towel beneath the ankles. This will support the person's lower back. Step number 2. Pour massage oil in the palm of your hand. Start with about 1 teaspoon, which is roughly the size of a quarter. Warm it by rubbing it between your hands before applying it to the person. Good oils to use are organic coconut oil, grapeseed oil, jojoba oil, or almond oil. There are many expensive scented and specialty massage oils on the market you can try too. Step number 3. Spread the oil around. The main technique for spreading the warmed oil across the person's back is called effleurage, which means light friction. Use gliding movements in long, even strokes. Use the whole of your hands and start at the bottom of the person's back, moving upward. Always upward toward the heart, the direction of blood flow, while applying pressure, and then lightly bring the hands down the outside of the back lightly. Maintain contact without applying pressure as you bring your hands back down. Repeat this technique for 3 to 5 minutes while gradually increasing from light to medium pressure to warm up the back muscles. Don't forget the shoulders and neck area. Step number 4. Use percussive techniques. Percussive uses shorter, circular strokes with more pressure than effleurage. You can think of this as a kneading technique that uses rolling and pressing to enhance deeper circulation. This technique can use the palm, fingertips, or even the knuckles in the short, circular motions. The movement should come from the waist, your core, rather than from the shoulders. This will help keep you from becoming fatigued. Go across the entire back for 2 to 5 minutes. You can alternate between this and lighter effleurage movements to diversify techniques. Without professional training, use only light to medium pressure while applying percussive movements. Step number 5. Apply percussive strokes. Percussive strokes, also known as step.Must, are collections of brief, repetitive contacts with parts of the hand. You can use your cupped hands, your fingertips all gathered to an even point, or even the flat of your fingers on the knuckle side of your hands to make the contacts. These movements have a stimulating, compressive effect on the tissue. Keep your wrists relaxed and flex at the wrists, using quick movements to perform step.Must techniques. This ensures that you don't apply too much pressure. Spend 2 to 3 minutes applying the techniques across the person's entire back. Step number 6. Use muscle lifting techniques. To perform this, close your fingers and hold out your thumb, in a lobster claw shape. Apply pressure in a twisting, lifting motion. Keep alternating hands in a windshield wiper movement. Move up and down the back 2 to 3 times. Step number 7. Use a fanning technique. Position yourself at the head of the table. Position your thumbs at the top of the back, just below the neck and on either side of the spine. Using a fanning motion with your thumbs extended, push gently down toward the lower back with your pressure angled at the person's feet, not down towards the ground. Alternate your pressure on either thumb, moving from the top of the back all the way down to the person's hips. Make sure you are massaging the muscles on either side of the spine, not directly on the spine itself. Massaging over the spine can be very uncomfortable and dangerous if you are not trained properly. Step number 8. Apply twists. Come back around to the person's side. Reach around the far hip with one hand, while the other hand rests on the near hip. With a fluid motion, pull one hand towards you as the other one pushes away. In the middle, they should slide against each other, in opposite directions. Repeat this stroke up the back until you reach the shoulder area, then come back down. Repeat 3 times. Which method you are using, tell us in comment section. Thanks for watching, keep watching and subscribe my guide for more videos.